You know, I never expected to leave nursing. I spent nearly 20 years in healthcare systems and honestly thought that's where I would stay for the rest of my career. But after giving up my RN license, I started working in different areas of healthcare trying to figure out where I could still make a meaningful impact. And two experiences completely changed how I saw independent medical practices. The first was working with a healthcare information exchange that connected smaller clinics to larger systems, larger healthcare systems. On paper, I thought that, it sounded pretty amazing. Practices could now see hospital discharges, outside records, specialist reports, and more patient information than they ever had before. But their biggest problem wasn't that they needed more access to information. The issue was, what do you actually do with it now that you have it? Patient gets discharged from the hospital and you get an alert. Now what? Who follows up? Who makes sure that the patient follows up? Who tracks it? Who makes sure that even outside of that follow up, that their preventive care gets completed to prevent disease later? Who makes sure it affects outcomes instead of just sitting in the chart or accumulating a bunch of red dot notifications? Most small practices were never operationally designed for that level of tracking and coordination. So instead of helping, a lot of these systems just created more tasks, more clicks, and more pressure on an already overwhelmed staff, basically increasing administrative burden on an already burdened practice, and then making the practice feel like they just wasted a bunch of money on something that's not even helping. Then I had another experience working around healthcare marketing and software companies targeting physician offices. My job was basically to build them a website and help them find leads, leads being patients. And the message was always get more patients, grow your practice, get more ads to attract leads. But what stood out to me the most, if a practice is already struggling with penalties, low performance scores, missed preventive care, or uncontrolled chronic conditions, bringing in more patients without fixing the underlying operational issues first can actually make the financial problems worse. That's when everything clicked for me. Independent practices don't need more patients running through the door. They don't need more access to more information. They need clarity around the patients they already have and around the data they already have under their clinical practice. Which patient population is creating the most risk? What's affecting reimbursement and which problems actually matter first? Because most physicians were trained to take care of the patient in front of them. They were never trained to manage attributed populations, quality scoring systems, reporting structure, preventive care tracking, and reimbursement risk all at the same time. And neither was their practice manager. And that's why I built this business to help independent practices finally understand the full picture of how their office is actually performing and how that is affecting their outcomes and what they can do about it to make a difference. So they can protect reimbursement, actually improve the patient outcomes, and remain independent in a healthcare system that is changing very, very quickly.